Osteomyelitis is an orthopedic disease. Look at this picture, shows that X-ray findings, CT findings, humerus, then MRI findings in knee joint, detail going on. Introduction. Osteomyelitis is a serious bone infection caused by bacteria, fungi, or other microorganisms. The infection can reach the bone through the bloodstream from nearby tissue or directly through an open fracture or surgical procedure. It can affect any bone in the body, but is most common in the long bones of the legs, arms, spine, pelvis. Definition. Osteomyelitis is defined as an inflammation of the bone and bone marrow due to an infection. The infection can cause the bone to become necrotic if left untreated, leading to severe complications. Types. 1. Acute osteomyelitis develops rapidly over a period of days or week. It often associated with recent injury or surgery and presents with severe symptoms. To chronic osteomyelitis, a long-standing infection that can persist for months or years. It may develop after a bout of acute osteomyelitis due to an unresolved infection. Three, hematogenous osteomyelitis caused by bacteria traveling through the bloodstream to the bone. It is more common in children and typically affects the long bones. 4. Contiguous osteomyelitis occur when the infection spreads to the bone from an adjacent tissue. This type is common in adults, particularly in those with ulcers, wounds, or surgical infections. Five, vertebral osteomyelitis, a specific type of osteomyelitis that affects the spine. It is more common in older adults and can cause severe back pain and neurological defects. causes. One bacterial infection, Staphylococcus aureus, is the most common causative organism. Other bacteria include Streptococcus, Enterobacter, and Pseudomonas. 2. Fungal infection, rare but possible, especially in immunocompromised individuals. 3. Trauma, open fractures or deep wounds can introduce bacteria directly into the bone. For surgical procedures, orthopedic surgeries involving implants can lead to infection if not properly managed. 5. Bloodstream infection. Bacteria can spread to the bone from infections in other parts of the body, such as the lungs or urinary tract. Risk factors. 1. Diabetes, poor blood circulation and immunoresponse increase the risk. 2. Peripheral vascular disease, reduced blood flow to the extremities can make bone more susceptible to infection. 3. Immunosuppression. Conditions like HIV/AIDS, chemotherapy, or long-term spread use can weaken the immune system. For recent surgery or trauma, increase the likelihood of infection. 5. Intravenous drug use. Shared needles can introduce bacteria into the bloodstream. Complications. 1. Bone necrosis. The infected bone can die due to lack of blood supply. 2. Psoriatic arthritis. Infection can spread to nearby joints. 3. Impaired growth. In children, osteomyelitis can affect the growth plate, leading to lymph length disturbances. 4. Amputation. In severe, unmanageable cases, amputation may be necessary. 5. Chronic pain. Persistent infection, nerve damage can result in long-term pain. 6. Systemic infection. The infection can spread to other parts of body, leading to sepsis. Pathophysiology. Osteomyelitis begins when bacteria or fungi enter the bone. The immune system responds by sending white blood cells to the site of infection, leading to inflammation. This inflammatory response increases pressure within the bone, reducing the blood supply and flow, and leading to Bone tissue death. The dead bone becomes a reservoir for infection, making it difficult to treat. In chronic osteomyelitis, the body may attempt to wall of the infection, creating a layer of new bone around the dead bone, further complicating treatment. Step by step process. 1. Initial infection. Entry of pathogen. Hematogenous spread. Contiguous spread. A direct inclusion. 2. Local inflammatory response. Immunoresponse activation. Inflammation. 3. Bone marrow and vascular compromise. Increased pressure. Vascular obstruction. 4. Bone necrosis. Ischemia. Formation of psychosocial. 5. Formation of involucrum. New bone formation. Chronic infection cycle. 7. Abscess formation and sinus tracts. Pus accumulation, abscess development, sinus tracts. 7. Systemic spread. Bacteremia. Sepsis. 8. Chronicity and complications. Chronic osteomyelitis. Complications. Understanding this pathophysiology helps in recognizing the importance of early and aggressive treatment to prevent the progression of the disease and the development of chronic osteomyelitis and its complications. Signs and symptoms. 1. Localized pain. Severe and persistent pain at the site of infection. 2. Swelling and redness around the affected area. 3. Fever and chillness. Systemic signs of infection. 4. Warmth. The infected area may feel warm to the touch. 5. Reduced mobility. Pain and swelling can limit movements, particularly in joints. 6. Fatigue. General malaise due to the body's response to infection. 7. Drainage. Pus or fluid may drain from the site, particularly in cases of chronic osteomyelitis. Diagnosis. 1. Blood test. Elevated white blood cell count. erythrocyte sedimentation rate ESR and C-reactive protein CRP levels indicate inflammation. 2. Blood cultures identify the causative organism. Imaging studies including one X-ray can show changes in bone structure in chronic cases. To MRI, highly sensitive in detecting early changes in the bone and surrounding tissues. 3. CT scan detailed imaging to assess the extent of bone damage. For bone scan, radioactive material highlights areas of high bone activity, indicating infection. 5. Bone biopsy, direct sampling of bone tissue to identify the pathogen and its antibiotic sensitivity. Nursing diagnosis. 1. Acute pain related to inflammation and infection of the bone. 2. Impaired physical mobility related to pain and swelling. 3. Risk for infection related to open wounds or surgical sites. 4. Hyperthermia related to infection. 5. Knowledge deficit regarding the disease, process and treatment. Management. 1. Antibiotic therapy, long-term intervention. Antibiotics often for 4 to 6 weeks are the mainstay of treatment. 2. Surgical debridement, removal of necrotic bone tissue to eliminate the infection source. 3. Drainage, surgical or percutaneous drainage of abscess. 4. Hyperbaric oxygen therapy promotes healing by increasing oxygen supply to the infected bone. 5. Immobilization, splinting or casting to reduce pain and prevent further injury. 6. Pain management, analgesics to manage pain. 7. Physical therapy to restore mobility and strength once the infection is under control. Treatment modalities. 1. Antibiotic therapy. 2. Surgical intervention. 3. Hyperbaric oxygen therapy. 4. Pain management. 5. Wound care. 6. Nutritional support. 7. Adjunctive therapies including bone grafts, bone transplant. Psychosocial medicine. 1. Emotional support. Chronic osteomyelitis can be a prolonged and distressing condition requiring psychological support for both the patient and their families. To patient education, understanding the disease process, treatment regime, and importance of compliance with therapy is crucial. 3 coping strategies help the patient develop strategies to manage chronic pain and the impact on daily life. For social support, involvement of social services for assistance with home care or rehabilitation needs. Prevention. 1. Prompt treatment of infection. Early and appropriate treatment of infection to prevent spread to the bone. 2. Good wound care. Proper care of wounds and surgical sites to prevent infection. 3. Diabetes management. Tight control of blood glucose levels to reduce infection risk. 4. Safe injection practices for intravenous drugs users to prevent bloodstream infections. In conclusion, osteomyelitis is a serious and potentially debilitating bone infection that requires prompt diagnosis and aggressive treatment. With advances in medical and surgical therapies, the prognosis for osteomyelitis has improved, but it remains a challenging condition with significant risk for complications. Early intervention, comprehensive care, and patient education are key to manage this complex disease effectively. Thank you. Have a good day.